Hey everyone, Mark here from Muscle Building Shorts. In today's video, I'm going to show you how you can treat your aching forearms and elbows using a couple of common household items such as a hammer and a butter knife. Now the forearm and elbow pain that I'm referring to is the muscle damage or soft tissue damage that occurs in the forearm muscles just below the elbow or just above. It can also occur on the inside of the forearm or just above the elbow. And for most people, this can be a result of doing a one-time task, maybe something that you're not used to doing. It could be a painting job on the weekend or a little bit of home renovation. Or quite often it's an occupational hazard. Maybe you use hand tools all day and you could be using a tool that maybe has a lot of vibration when you're using it, or sudden impacts or repeated impacts. And of course, it puts a lot of strain on the muscles in the forearms. And it can also, for the rest of us, happen when we're, having a little bit of fun there in the gym. There, we're doing some exercises or some challenging obstacles or whatever, where we're having to grip and hang, putting a lot of, over stress on the forearm muscles as we have to grip onto things. So what happens is, because of this micro trauma that happens around the forearm muscles, the muscles have a tendency to shorten, they tighten up, they start pulling on the tendons, which causes inflammation in and around the elbow, like I said, either on the outside or the inside. So what we're going to do is we're going to do a couple of treatments to help remedy this. So the first treatment I'm going to show you is what I like to refer to as the hammer trick. And the goal of this treatment is to help stretch out these muscles, get them to relax, both on the outside and the inside, as well as progressively strengthen the forearm muscles. So what we're going to be doing is we're going to be using this hammer. What I want you to do is you just want to grip lightly. You don't want to be gripping hard, because gripping hard, of course, is what caused part of the pain in the first place. You just want to have enough to be able to support the hammer, holding it just below the head. And what we're going to do is we're going to just twist the arm inward as far as we can. You're going to notice you're going to feel a stretch on the outside of the forearm. You want to go to the point that you can't go anymore, but you don't want it to be painful. But you might have a little bit of that ache that you've been experiencing. That's okay. Now we're going to rotate to the outside. Again, and go as far as you can without it being painful. Now you're going to feel a stretch on the inner side of the elbow. Next, what I want you to do is grab the midway point of the handle. Now we have a lot more weight on the above the hand. We're going to do inward rotation as far as we can go, and then an outward rotation. Now, a key thing is you want to be controlling the weight of the hammerhead going down. You don't want it to just fall. You want to be in control, but at the same time, you don't want to be gripping too hard. Now we're going to grab it at the very base of the handle, so we have even more weight now on the top. That makes it a little bit more challenging. I'm going to rotate inwards. Just want to do this slowly. Go as far as you can. And then back. So because we started off with our hand here, and then moving down, we're progressively getting more challenging. That'll help strengthen the forearm muscles. At the same time, we're doing stretch. So what we're going to do now is we're going to progress even more by adding repetitions. So we're going to call this 1 rep in, 1 rep out. Now a second repetition in, and a second repetition out. Just like the first round, we're going to grab down now at the midway point. 1 repetition in, 1 repetition out. Second repetition in, second repetition out. And of course, you're going to want to do this for both arms, regardless of the level of pain or ache on either side. It's good to do things in balance. Now we're going to do it holding at the very base of the handle. 1 repetition in, 1 repetition out. 2 repetitions in, 2 repetitions out. At this point, you may find that your arm's getting a little fatigued. If it feels fatigued at any time during this treatment, just give your arm a little bit of a shake out, get the blood flowing a little bit, take a little bit of a break. Now we're going to do our last round. Again, we're going to just hold it just below the hammerhead. Now we're going to go to 3 repetitions. So 1 repetition in, 1 repetition out, 2 repetitions in, 2 repetitions out, 3 repetitions in, 3 repetitions out. Already I'm feeling a little bit of fatigue. I'm just going to shake it out. Grab at the halfway point. 1 repetition in, 1 repetition out, 2 repetitions in, 2 repetitions out, 3 repetitions in, 3 repetitions out. It's get a lot more challenging the more repetitions you add. And this is a treatment that I would recommend for anybody who has even just mild or chronic elbow pain. You could probably do this 2 times a day, even 2 to 3 times a day. Now we're in the last round. We're holding right at the base. 1 repetition in, 1 repetition out, 2 repetitions in, 2 repetitions out, 3 repetitions in, 3 repetitions out. So now we've progressively built up strength along the forearm muscles, inside and outside, as well as increased that stretch. Like I said before, you want to do it both on the right side and on the left side. So for our next exercise, we're going to be using a butter knife. We're just going to be using the handle. I just want to say this about butter knives. You see the one I have here on the left. It's very thin. It's got very straight edges on there. We don't want to use a knife like this. We want to use a knife that has a handle that's a lot thicker and has rounded edges. Because what we're going to be doing is what's known as the Graston technique. And it's a muscle scraping technique to break down scar tissue and adhesions. You see, what happens is a lot of people have chronic elbow and forearm pain. They have it because they've been doing an activity, the body tries to do the repair, but we continue to do that activity. Let's say it's an occupational thing, or we keep going to the gym doing the same activity, and we're undoing that patchwork. It's kind of like, if a surgeon, stitches you up after surgery, and then the next day you go play tackle football, and you undo all those stitches. Then he's got to go patch it up again, but then you go out and you play football again. So all this continued undoing and redoing of the patchwork creates this leftover scar tissue and adhesions. That too can create a lot of tightness in the muscles, pulling on the tendons, and again, adding inflammation. So I'm going to show you how to do this Graston technique, also known as muscle scraping. So in the Graston technique, the object is to use the instrument to scrape the muscles. We're going to hold it at a 45-degree angle to the arm. We're going to scrape the muscle, putting a little bit of pressure on, and we're going to be feeling for the difference between when it feels smooth to when we get into this gravelly area. You start to feel you're getting into bumpy, gravelly area. That's usually meaning that's where the scar tissue is, those adhesions. We're going to be breaking those up by applying pressure as we go along. As well, it's going to get blood flow going into the area, and of course, it's going to promote healing. Now, one thing I want to make a note of that we don't want to cause abrasions or damage to the skin. So you're going to want to use some kind of massage oil. I like to use coconut oil. And if you're wearing pants or whatever, you want to maybe drape a little towel over there so you don't get oil on there. And you can just apply it. You can do it. We're going to work on the forearm, outer forearm first. You're going to want to work it in. You can see it there. You don't want to work it in too much because you want it to still be a little bit slick. And so you want to be able to run the knife over the area. What you'll probably notice is closer up to the elbow, that's where the tendons are joining on to the top of the bone here. That's probably where you're going to feel a lot more gravelly sensation. Now, one thing you probably will notice in very short order going over that gravelly section, you can see here I'm getting some redness. That's absolutely normal. That means blood's coming to that area. It feels that we're breaking down that scar tissue, and it's going to bring a lot of healing with it. Fresh blood going through there. Now, I'm talking the whole time while I'm doing this, but of course, if you're doing this yourself, just breathe naturally because you're going to want to bring oxygen into that blood as well. So after you've done the one direction, of course, you can go down the other direction. If you feel that it's smooth, you don't have to stay on that area. You can just move along to another area. You don't want to do any more than about 20 or 30 seconds in any one spot. Like I said, if you do see redness, that's absolutely normal. And you want to be pressing hard enough that you feel yourself going through that grit, but not too hard that you're causing any kind of abrasions. There is a technique in Chinese medicine called gua sha, where they actually press pretty hard and they use special tools to actually bring out almost semi-permanent particular damage. We're not going for that here. We just basically want to gently break up the muscle adhesions. We don't want to be doing anything too extreme. For me, it's always been the outer elbows that hurt the most, which is why I like to put a lot of attention to that area. Like I say, you want to go in both directions to help break that up naturally and evenly. Some people feel it more below the elbow. Some do it above. You can get sometimes a little bit of inflammation where the brachioradialis comes across here, muscle just underneath the bicep and in between the tricep. Sometimes people get stressed there. Yeah, I can feel a little bit of it here. And I can see some redness building up. And of course, you can continue to the inner side of the forearm as well, feeling for that transition between the smooth and the gravelly bits, working on those gravelly bits there. And because the butter knife trick, the Graston technique, is kind of a destructive technique, that is, we're doing some damage, mild damage, by breaking up those adhesions, that scar tissues, to promote healing. It's something that you don't want to do every day. In fact, I'd recommend no more than about 2, maybe 3 times max a week. Whereas the hammer technique, definitely you can do it 2 to 3 times a day, every day. It's not really destructive. It's a muscle building and a stretch exercise. This is a little bit of a destruction here, but it will promote the healing. It will bring blood flow into that area and to heal up your forearms. Anyway, I hope that you found this video helpful. Butter knife and hammer trick. I'm pretty sure you have these at home. Give it a try. Thanks for watching.